When deciding whether you should go original Medicare or Medicare Advantage, one of the factors you're going to think about are the cost, how the two different systems work. My name is Debbie Riskin. I work at GM Goldman and Associates. That's my family business. I work alongside my dad and my brother, and I want to walk you through an exercise that I do every day with clients to help them give or get an overview of how the two different systems work and how the different costs could affect your budget. So let's take a look. So start by taking out a piece of paper and a pen if you want to have some sort of notes on this exercise that we're walking through, and draw a T through the paper. So hence the Medicare T. And in column number 1, write down Medicare, original Medicare, and column number 2, write down Medicare Advantage. Now, under both columns, if you could write Part A, hospital coverage, and write $0 monthly premium, and then write down 40 quarters. So whether you go original Medicare or Medicare Advantage, you're going to enroll in Medicare Part A, and most people have earned Medicare Part A premium free, hence the 0 monthly premium. All these years when you're getting your paycheck or your spouse's and you're seeing a FICA tax coming out, if you have 40 quarters of work, that means that you've earned Medicare Part A premium free. If you have not, then you may pay a premium for Medicare Part A. Now, also under both columns, write Part B and in parentheses doctor/medical, and then write down $164.90 monthly and write down IRMAA. So let me explain. When you have Medicare Part B, and again, you're going to sign up for both A and B, you are going to have a monthly premium, just like you would with your insurance now. Now, some people are surprised to learn they have a premium, but as I already explained, that FICA tax goes towards Medicare Part A. So $164.90 is a standard monthly premium in 2023. But let's talk about IRMAA and what that means. Some people, if you're a higher income earner, you're going to have what's called an income-related monthly adjusted amount, and that's going to be determined by the Social Security Administration. So what happens is they look at your tax return from the prior year, which is going to be based on your taxes from 2 years ago. And they look at your modified adjusted gross income to determine if you're going to pay more than the standard premium. This is a chart that I copied from the Humana website, and it charts out the IRMAA adjustments, the possible amounts that you could be paying. So if you look at column number 1, for a person filing single, if you make $97,000 or less in 2023, then you're going to pay the standard $164.90. For someone married filing joint, if you make $194,000 or less together, you're also going to pay the standard premium. But when you start to look at below those numbers on the chart, you're going to see a scale of the more you make, the more you pay. So if you look, for example, at a single person making between $123,000 and $153,000, your Part B premium in 2023 is going to be $329.70. But if you look at the joint column and you're making between $194,000 and $246,000, your monthly premium, each of you are going to pay $230.80. So the point is, you look at one of these charts to help you figure out what you need to budget. You will receive a letter from the Social Security Administration letting you know what your IRMAA is going to be, but this just gives you an idea now if you're starting to research this. Also notice that the last column on the chart says Part D. There also is an IRMAA adjustment when it comes to Part D. It's the same income thresholds, and the column to the right lets you know what you're going to pay in addition premium for your Part D plan if you do go with original Medicare. That IRMAA also applies with Medicare Advantage. So now I want you to draw a line under Medicare, under Part B, where we have that on the chart. Whether you go original Medicare or you go Medicare Advantage, you're going to sign up for Part A, you're going to sign up for Part B, and you're going to have that Part B monthly premium. But now notice that there are two different rectangles under original Medicare and Medicare Advantage, and one says pay up front and one says pay as you go. So we started with the way that two systems are similar, but now we're going to go into how the systems differ. Medicare Original being pay up front and Medicare Advantage being pay as you go. So let me explain. Okay, so original Medicare is designed where not every dollar is covered. So if you have a Medicare approved claim and you did not get a Medicare supplement policy, you'd be paying part of the bill. You get a Medicare supplement policy to help cover some of the co-pays, the co-insurance, etc. And what's going to happen is that depending on which plan you choose, that's going to determine which gaps or co-pays are covered. If you look at this chart, you're going to see on the left-hand column, and I'm sure you've seen this chart all over the place, the different gaps and benefits that you could get covered in a Medicare supplement policy. And if you look across the top, you're going to see the 10 different plans that are offered in the marketplace. Plan F, which is in the middle, that covers every possible gap. But F is only offered now to people who were eligible for Medicare prior to January 1st of 2020. So if you move over to G, that's going to be your next most comprehensive plan, and it's going to cover all the same dollar gaps as F, except for the Part B deductible, which in 2023 is $226. So when you look at this, you get a Medicare supplement, you pay for it up front, and that's going to help determine what your monthly cost is going to be, but that's what you're going to budget for, and you're going to cover most of the dollar gaps. Now, what are you going to pay as a monthly premium for your Medicare supplement policy? That's going to depend on a lot of factors. Your zip code, your age, your sex, which plan you're choosing. Are you a smoker? Do you get a couples discount? But the point being is that you are going to create a monthly premium that you're going to pay whether or not you walk into the doctor's office. You're paying up front. Now, in this particular example for Medicare Supplement Plan G, a 65-year-old female in the Chicago area, she would pay $123.67 with the particular carrier. And we know what would happen is that all her bills would be covered if she had medical services, except for the first $226, the Part B deductible. So if you get a Medicare supplement policy, that means you've stayed in original Medicare. If you notice the X in there, if you go Medicare Advantage, you do not get a Medicare supplement policy. Now, in addition, you're also going to need a Part D plan, which is a prescription drug coverage plan. The medications you pick up at a Walgreens or a CVS or etc., that's why you need a Part D plan. There are medications that could be covered by Part B. Those are injections or IVs that you have to get when you go to a hospital or to a medical facility, but we're focusing right now on Medicare Part D. So what happens is when you get a Medicare Part D plan, you're going to pay a monthly premium. It could be $8, it could be up to $100. You're going to have a deductible, co-pays, and co-insurance. And it's really hard for the sake of this video to give you an idea of what the cost would be, because when you're choosing a Part D plan, you're going to give whoever you work with the list of your medications, and they're going to match up what's going to be the most cost-effective Part D plan for you based on your zip code. If you notice in the right-hand column, there's an X, because if you go to Medicare Advantage, you don't get a Part D plan. And if you go original Medicare, you don't get a Medicare Advantage plan. Now, let's switch and let's talk about Medicare Advantage. But before I do that, let me just give you that wrap up on original Medicare. So basically, why is it paying up front? Because you're paying a Medicare supplement premium, whether or not you walk in the door to a doctor's office, and you're going to pay a Part D premium, whether or not you pick up prescriptions. But what you're doing is you're managing your costs and you're covering a lot of the gaps. When it comes to Medicare Advantage or Medicare Part C, it works differently. You eliminate the Medicare supplement and the Medicare Part D premium, and you have a low or no monthly premium. And what's going to happen is the trade-off is that while you're not paying up front, you're going to pay as you go. You're going to pay a maximum out of pocket. That amount is going to be defined by the plan. And what happens is if you, let's say you go and you have a service, you may pay a deductible, a copay, or a co-insurance, but the most you can spend is that max out of pocket, and we'll talk about that a little bit more. Also built into most Medicare Advantage plans are prescription drug coverage. Now, not every plan has it built in, but most of them do, and you're going to have deductibles, copay, and co-insurance just like you would with a Part D plan, and IRMAA is going to apply to the Medicare Advantage plan. So you see the X under Original Medicare, that's because if you're in if you're in Medicare Advantage, then you're not in Original Medicare and you don't need that supplement or that Part D plan. Now, this can be kind of confusing, this overview, so I want to give you an example of exactly what I mean. So let's take a look at this next slide. Okay, going back to the example we talked about with Medicare, with the Medicare Supplement Plan G. This person is going to pay $126.67 whether or not she walks into the doctor's office, about almost $1,500 a year in annual premium, but you can pay it monthly, and the first $226 of Part B doctor bills. So let's say this person goes, she has an inpatient hospital stay under Part A, 2 days. There is a $1,600 deductible under Medicare Part A, and I haven't gone into all the deductibles. That's for another video, but just trying to understand how it all works with the dollars here. So there's a $1,600 deductible. Medicare Supplement Plan G is going to cover that deductible. So what happens is that you've already paid your monthly premium, and that's all you're going to pay. There's nothing additional. When it comes to the Medicare Advantage plan, now you're in a plan where you have a $0 monthly premium, but now you have this $2 2-day hospital stay. And with this stay, you have to pay a $300 copay a night. Now, that's not every plan. I'm just using that as an example. And that $300 a night is going to go towards your max out-of-pocket. Now, the highest max out-of-pocket that any Advantage plan can do for in-network is $8,300. That's defined by Medicare. But your plan may have a $2,500 max out-of-pocket or $3,200 or $6,000. It's going to depend on your zip code and the plan you choose. But the point being is that in this scenario, this person didn't pay any monthly premium, but they do owe $600 as a copay for that 2-day hospital stay. Let's also look at an example for Medicare Part B. So let's say you went and had an MRI. I don't know what an MRI costs, but let's say it was $1,000. And under column number 1, Medicare pays $800 because they owe 80%. That's how Original Medicare is designed. And then there's that $200 remaining, and that's the job of your supplement. Now, if you hadn't met the Part B deductible, you'd be paying that first. But let's say you've met it. Medicare pays $800, supplement pays $200. You don't pay anything more. You've paid your monthly premium. Under the Medicare Advantage example, let's say that the plan you're in defines a Medicare, or actually, I'm sorry, that you'd have to pay a $240 copay for an MRI. So you're going to owe that. You're paying a 0 monthly premium, but you're cost sharing as you go, and that $240 counts towards your max out of pocket. One thing I also want to mention with the max out of pocket with the Medicare Advantage plan, your drug copays and coinsurance don't count towards that. So bottom line is that when you're thinking about which way you want to go, you're going to look at these two different systems. And there's other factors, of course, you're going to be considering, but just know that the cost is a big one. And you got to think, are you going to go Original Medicare, know exactly what you're spending and build it into your budget, or are you going to go Medicare Advantage and eliminate those costs, but knowing that if you do need health services, you're going to end up paying? In going over the different ways the cost structures work, you're going to think about, should you go Original Medicare or Medicare Advantage? And that's why you want to find an expert, somebody that can help you kind of navigate through this. It's a big decision. This is what we do, and we are here to help. If you are looking for this kind of guidance, reach out to us. We'll let you know if we're licensed in your state. And we are independent. We work with multiple carriers. Also know that when you work with an agent, you do not pay us anything. We earn a commission. And so our only job in specializing in both Original Medicare and Medicare Advantage is to listen to you and help you figure out which is going to be the best path for you.